A state joint committee passes 9 American Rescue Plan Act projects that will be heard by the full legislature now. And the projects are for more than $300 million. News 9's Angelicia Bruton joins us with a breakdown on how this money may be used. Angelicia?
Amanda, many of the projects passed will go towards mental and behavioral health services here in Oklahoma. Members of the committee believe allocating pandemic relief money to these projects will address crucial needs for the state.
Oklahoma has $1.87 billion in ARPA funds. Projects approved must be geared towards people, infrastructure, and the economy.
There were lots of testimony on the impact that the pandemic had on behavioral health.
The Joint Committee hearing the Oklahoma Department of Mental Health and Substance Abuse concerns.
We have aging and challenging facilities that were unprepared to deal with the COVID crisis.
Projects for millions of dollars were passed for taking care of the well-being of Oklahomans across the state. $38 million to go to services at a new Tulsa Center for Behavioral Health, and $87 million to replace the Griffin Memorial Hospital in Norman.
9 ayes, 0 nay. The House carries the motion.
More projects were passed focusing on the physical, mental, and spiritual needs of first responders, airmen, and soldiers, something that Brigadier General Thomas Mancino says is needed.
What we have found in working to try to overcome this horrible tragedy we have of soldier suicide and airman suicide is that it needs to be a holistic approach.
The committee unanimously passed $22 million for a holistic health and fitness center, a one-stop shop with nutritionists, sleep experts, counselors, and more.
The COVID pandemic itself has led to a greater increase in mental health stress on our force, as it has on most people. I'm just very thankful that we're receiving the consideration that we are.
These projects will be up for approval when a second special session reconvenes. Angelicia Bruton, Oklahoma's Own News.